Good afternoon, everyone, and thank you for attending the inaugural State of Homelessness Address in Orange County. My name is Becks Heyhoe, and I am the Executive Director of United to End Homelessness with Orange County United Way, and this event is part of this year's Hunger and Homelessness Awareness Week campaign. Today, you are going to hear from some of the people who are at the forefront of leading the governmental efforts to end homelessness in our community. There are many efforts that are being underway, and I would be remiss to not mention a few things of note, including how a number of our state elected representatives have championed the sourcing of funding for homeless solutions in Orange County, such as Senator Josh Newman, who previously secured $20 million for 10 cities in North Orange County to work together as the North Orange County Public Safety Collaboration, ensuring that the nonprofits in the region have the resources needed to do the essential work to address homelessness. 2021 saw the final allocation of that funding, and we are pleased that Senator Newman has secured an additional $8 million for 2022. I would also like to highlight Assemblywoman Connie Petrie-Norris, who secured $2.9 million in the state budget for the work to end veteran homelessness through our own Welcome Home OC program. These are excellent examples of collaboration between the public and private sectors. Solving homelessness isn't solely the responsibility of government, though. We all have a role to play in making sure that proven solutions are brought to scale at the rate needed to house those without a home right now and to stem the tide of people falling into homelessness in the future. The private sector has answered the call through both funding and collaboration. 79 property owners in the Welcome Home OC network have been instrumental in providing hundreds of units of permanent housing for formerly homeless individuals and families, none of which would have been possible without the partnership of the Apartment Association of Orange County and the California Apartment Association. This year, we have also seen a number of law enforcement agencies reform their approaches to responding to both homeless and mental health calls for service, notably Anaheim, Huntington Beach, and the OC Sheriff's Department. The healthcare community has also been involved. I think of the work of Barry Ross at Providence and Joseph Health, funding People for Housing, the Kennedy Commission, and our own Housing Champions program to engage local citizens in housing element work. This is certainly not a comprehensive list of all who have been involved, from funders and nonprofit service providers to the faith community, from business and corporations to individual advocates. So many are a part of the movement to end homelessness. This afternoon, I am delighted to welcome our speakers to share from their vantage points some of the wins from 2021, as well as ongoing challenges that need to be addressed in the coming year. I would now like to welcome Supervisor Doug Chaffey of the 4th District, Chair of the Commission to End Homelessness, and Vice Chairman to the Board of Supervisors.
Thank you for the introduction. I'm Supervisor Doug Chaffey, the Vice Chairman of the Board of Supervisors and the Chair of the Commission to End Homelessness. I also currently chair the Orange County Housing Finance Trust Board and able to participate in other boards, including CalOptima and the Orange County Criminal Justice Coordinating Council, to assist in the overall development of Orange County's system of care. This includes focusing on building housing with the help of the Orange County Finance Trust, coordinating regional policy on homelessness through the Commission to End Homelessness, and addressing justice issues with the Orange County Criminal Justice Coordinating Council. In recognition of the Hunger and Homelessness Week, it is an honor and privilege to participate in this State of Homelessness Address, provide an overview on the county's response to homelessness and overall impact on serving those most vulnerable in our communities. The causes of homelessness are complex. There are often multiple factors at play leading up to a homelessness crisis: loss of income, relationship breakdown or separation, poverty, and other social economic factors all affect an individual or family's access to housing. The solution to homelessness are equally complex. Interventions must be tailored to an individual's needs and Our approach must be trauma-informed, recognizing the harm that becoming homeless can cause to someone's mental and physical health. There's often an intersection between homelessness and behavioral health, community corrections, healthcare, housing, and benefits and supportive services. In the county, we have made significant progress in expanding each of these service areas and are focused on continuing improving the care provided to those we serve. To respond to the growing housing crisis, the Orange County Housing and Finance Trust was established with the mission of strengthening the communities in Orange County by financing the development of affordable housing for homeless and low-income families and individuals. The vision is to identify and secure funding that will contribute to the construction of at least 2,700 permanent supporting housing units by 2025. To date, the Orange County Housing Finance Trust has approved and funded 1,176 permanent supportive housing units. Those 1,176 units include projects that have completed or in some stage of development. Our healthcare agency and the Orange County resources are collaboratively working together to ensure there's a streamlined, consistent approach to making referrals to permanent supporting units. While we've made great progress in developing affordable housing, there's still so much more to be done. As chair of the Commission on Homelessness, I've worked to put together a plan that will better engage the talents of the members and more effectively analyze the different pieces of the homeless system of care. We're working through 4 pillars: prevention, outreach and supportive services, shelter, and housing. The goals is to meet with local providers, national experts, and those who experience homelessness to ensure services we provide under these 4 pillars are consistent with best practices. Utilizing the Commission members' expertise in areas of focus, we're working to identify guiding principles for each pillar that will guide capacity building and service development across the homeless system of care. Hope to take these recommendations back to the Board of Supervisors for approval. Regarding law enforcement and justice issues, the Orange County Criminal Justice Council has recently developed OC Cares, an initiative to improve public safety on behalf of Orange County residents through interagency communication, coordination, and collaboration. There are 5 pillars guiding the work and focus of the Orange County Criminal Justice Council, which are prevention, courts, in custody, reentry, juvenile and transitional age youth. As part of this initiative, the county has established a coordinated behavioral health response hotline with OC links for those in need of services and resources that are available 24 hours a day, 365 days a year. Additionally, the first behavioral Be Well Orange campus is fully completed and open to provide services for crisis stabilization and substance use treatment. All these accomplishments and initiatives feed into our goal of expanding access to services and meeting the response to COVID-19 pandemic. Created and implemented Project Home Key, Project Two Belt, and Project Home Key. We implemented Project Home Key to provide isolation and quarantine protections for those experiencing homelessness who were vulnerable to COVID-19 and or symptomatic. We followed up with Project Two Belt, which was designed to ensure homeless individuals had a place to go after participating in Project Room Key. Both Project Room Key and Two Belt created an opportunity to work with individuals with whom we had not previously engaged and to use every tool in the Two Belt approach to meet the needs. Project Room Key, by the numbers, served 2,849 individuals and was successful in connecting with individuals who previously were not engaged with the homeless system of care. Project Two Belt served 544 individuals, which included permanently housing 355 individuals. The county has also leveraged the many different resources to combat the long-term effects of COVID, especially those experiencing homelessness. The Two Belt project is a great example of leveraging COVID response resource to continue to build a homeless system of care. Through the Home Key program, so far the county has been able to fund the acquisition and conversion of 2 motels into permanent housing, including the 60-unit Tahiti Motel and the Stanton Inn with 72 units, both located in the city of Stanton. Building on the success of both Project Home Key and the first round of Home Key Round 2 continues a statewide effort to sustain and rapidly expand housing for persons experiencing homelessness or at risk of homelessness and who are then inherently impacted by Project COVID-19 along with other communicable diseases. In Round 2, the Department of Housing and Community Development is providing approximately $1.4 billion in grant funding. The county is working with local cities and developers to pursue Home Key Program 2 opportunities and encourage those interested to apply. Additionally, the county has been working with Public Health Services to provide an opportunity to vaccinate shelter participants. And all emergency shelter providers have been contacted to provide the opportunity to vaccinate shelter participants. As we move forward, to keep each other informed is very important to ensure an alignment of efforts in providing solutions to the complex issues we face in homelessness. Thank you to United Way and all other participants and our viewers joining in today. Thank you.
Thank you so much, Supervisor, for your remarks. I would now like to welcome Tim Shaw, the Chair of the Orange County Continuum of Care Board, for his remarks today.
Thank you. Thank you all for joining us today. I'm privileged to be here with Supervisor Chaffey, Doug Beck, and Tim Houchin. And thanks to Orange County United Way, Sue Parks, Becks, and the rest of the team for putting this together. I currently chair the Orange County Continuum of Care Board. This is a body mandated to exist by the Department of Housing and Urban Development for regions eligible to receive federal Continuum of Care dollars. In partnership with the County of Orange, we not only oversee the distribution of millions of dollars in federal and state funds to address homelessness, but we also have responsibility for ensuring a responsive, efficient system through the oversight of the Homeless Management Information System and the Coordinated Entry System. In the time I have, I can't possibly cover everything we've done in the past year, but I'll provide some highlights and also talk about some areas where we must improve. First, let's talk about some of the good news. In the past year, the Continuum of Care Board oversaw the process to apply for, receive, and distribute over $32 million from HUD through the annual Continuum of Care process. I was actually one of the people who led the very first application for these funds in the mid-90s. From that initial regional allocation of $7 million, renewals have brought more than $400 million into Orange County. In the past year, these funds have expanded rapid rehousing programs and permanent supportive housing. In addition to these federal dollars, the state of California uses the Continuum of Care Board as a distribution vehicle for millions of dollars of state funding. In the past year, the Orange County COC Board oversaw the distribution of over $3.6 million in Homeless Emergency Aid Program, Homeless Housing Assistance and Prevention, and California Emergency Solutions and Housing dollars from the state, funding everything from homeless prevention, outreach and navigation, emergency shelter, rapid rehousing, and permanent supportive housing. Beyond the funds distributed, the COC Board acted aggressively to make several systems improvements. We funded the executive director position for the Family Solutions Collaborative. We strengthened the process and added new contributors to the Homeless Management Information System, which will help us generate better data. Our Coordinated Entry System Committee recently recommended reforms that will make CES easier to manage and base it around a more equitable framework. We approved funds and chose a consultant to conduct a racial equity assessment of the homeless service system, understanding that people of color are disproportionately represented among those experiencing homelessness. We formed the Lived Experience Advisory Committee, which I'm very proud of, and which provides opportunities for policies, processes, and fund distribution to be informed by those who have themselves experienced homelessness. You'll hear more about that from its chair, Tim Houchin. When the American Rescue Plan went into effect, the COC Board was appointed the responsibility of developing priorities for the use of over 1,000 new emergency housing vouchers. In a short time, we executed the required agreements with the Orange County, Santa Ana, Garden Grove, and Anaheim housing authorities, affirming those priorities so that individuals and families from our coordinated entry lists could be matched with vouchers, which will permanently end their homelessness. With huge thanks to our housing authority partners, I'm happy to report that the housing authorities have now referred an eligible individual or family to nearly all the existing vouchers. And in the last month, we've seen our first leases executed. Before I move on to what we must improve, I want to thank all the service providers we fund. None of this is possible without your hard work and dedication. I never cease to be awed by your passion, commitment, perseverance, and compassion in the most difficult of conditions. And I also want to thank our staff at the COC for all of their hard work. So that's certainly not all, but some of the progress we've made in the past year. And as the chair of the COC board and an advocate to end homelessness for over 30 years, I feel real strongly that we need to celebrate our successes. It's amazing news when a single person experiencing homelessness has that condition permanently remedied. But we also need to be transparent and honest about where we still need to improve. Homelessness is a completely unnecessary condition. It is shameful and immoral that we literally spend more money to keep people homeless in our county than it would cost to end homelessness. So where must we improve fast to move closer to ending homelessness? Well, this year, COVID derailed plans to conduct the annual point in time count, and importantly, the transitional age youth point in time count. We will complete these counts in January of 2022, but we simply must get better data on the transitional age youth population. We're proud to have executed contracts with CityNet for the general point in time count and Covenant House for the first ever transitional age youth count. We must break down any barriers that inhibit regional collaboration by all toward ending homelessness. There are too many silos and misalignments that cities, county departments, private philanthropy, service providers, advocates, and yes, the Continuum of Care Board allow to exist. One of those barriers is a lack of comprehensive fiscal mapping of all homeless funding in our county. Right now, those allocating precious finite resources do so mostly in a vacuum, unable to see the big picture to make the most informed decisions. This is wasteful and inefficient. I've initiated a dialogue with county staff and Continuum of Care leadership around engaging in a comprehensive fiscal mapping project in the coming year. Another area where we must improve is in fighting for and securing and efficiently deploying the dollars necessary for supportive services in permanent supportive housing, particularly in scattered site housing, such as what the emergency housing vouchers provide. The process right now is too fragmented, lacks accountability for success, and must be cobbled together from disparate pots of funds. We must solve this for permanent supportive housing to be the amazing solution we all know it can be in ending homelessness. Now, I've been around long enough to remember when there were virtually zero emergency shelter options in Orange County. Over the last 5 years, Orange County has finally moved toward meeting the need for emergency shelter. This is good, but it is no substitute for permanent housing. We now find ourselves in a situation where people are remaining in emergency shelter for far too long because we haven't produced the permanent supportive and affordable housing to erase that bottleneck. This not only compounds the trauma of people experiencing homelessness, it places further pressure on the system and emboldens false assertions of service resistance by those who don't want to remain in congregate emergency shelter. This can lead to further rationalizations of anti-camping ordinances and other measures intended to criminalize homelessness. Homelessness is not a crime. No one should stay in emergency shelter for longer than 2 weeks. We must make progress in approving more housing. As we move into 2022, the COC board is developing a 3-year leadership vision. This is our collective story of the future toward which we will align measurable goals and objectives. We intend to hold ourselves accountable for important and broad components of the system to end homelessness in Orange County. This vision will be presented at our next meeting on November 17th. I invite you all to attend this in all our public meetings. The COC board is one of the only forums in the county where you can make your voice heard. We've intentionally redesigned our committees to allow for more public input and discussion. As I said, homelessness is not only immoral, but also a completely unnecessary condition we allow to exist. I call on city councils to cast the courageous votes to approve permanent supportive and affordable homes and meet your very low income and low income regional housing needs assessment goals in your cities. And I call on residents in each city to hold your elected leaders accountable to those votes and support them when they do the right thing. And I call on private philanthropy and communities of faith to step up even more, make ending homelessness a priority, and coordinate efforts with government, service providers, and housing developers. And lastly, I call on my colleagues and members of the Continuum of Care to avoid complacency, embrace an ambitious vision, eliminate silos, and hold ourselves accountable. And if we do that, next year we'll have a lot more good news to report. Thank you.
Thank you so much, Tim. We will now move to Tim Houchin, another Continuum of Care board member and chair of the Lived Experience Advisory Committee. Tim, I'm delighted to welcome you to give your remarks.
Thank you, and thank you for inviting me to present during this important address. In 2020, I was elected to the Orange County Continuum of Care Board as a designated seat representing persons with lived homeless experience. Early in 2021, I was asked to chair an advisory committee to the board called the Lived Experience Advisory Committee. The committee consists of persons with lived homeless experience from around the county, both by location and relevant expertise representative of specific subpopulations of homelessness. The diverse combination of experiences provided by members of the advisory committee offer insight and unique perspectives of how homeless persons currently navigate services in Orange County. The committee also supplies other useful information to the board upon request in order to facilitate intelligent and more effective decision-making by the COC board. The Lived Experience Advisory Committee is additionally tasked with raising community awareness pertaining to homelessness. The committee recently established a partnership with OC United to End Homelessness and helped in planning this year's upcoming annual Hunger and Homeless Awareness Week. As competition increases over the rightful and intended use of public space in Orange County, so does the right to exist decrease for persons experiencing homelessness almost everywhere, and often leaves them with nowhere to go. Recent shelter closures come at a time when new, more restrictive shelters are replacing them with more limits on who is eligible to enter. Shelters require referrals from police, healthcare workers, or agencies contracted to provide outreach services. Not one year-round homeless shelter in Orange County provides access to walk-in clients. The shortage of shelter beds in South County is undeniable, yet homeless persons are pushed from encampments there into the streets without their needs for the shelter and services fulfilled. Mary's Kitchen in Orange faces permanent closure despite being a staple for homeless persons for decades and providing them with a variety of services and resources that are often unavailable elsewhere. Mary's Kitchen has always been a place where homeless persons could be, a place where they could exist, a place where they could go. It's a model that should be duplicated across the county, but instead it's now threatened with permanent extinction. Fullerton was once home to the county's first safe parking program designed to assist those living in cars and recreational vehicles. The program provided a secure place to park at night, restrooms and wash stations, and access to valuable services and resources, including housing. The pilot safe parking program ended when city officials decided not to continue funding it. Ironically, both Fullerton and Placentia passed ordinances prohibiting parking of habitable recreational vehicles on city streets this year, joining many other cities in Orange County with similar existing ordinances. When we eliminate places where homeless persons can go, we also eliminate places for them to connect with important services, resources, and access to housing. Without proper places to go, homeless persons are left to contend with legal repercussions as an additional consequence of life on the street. Unsheltered homeless persons have a much higher rate of interaction with police officers than others. They may receive tickets and citations with fines that they cannot pay. A criminal record will make it more difficult to secure employment, housing, and other resources. Sweeps of homeless encampments conducted by police often result in simply moving people from one place to another in order to satisfy complaints from residents and businesses. In all fairness and respect, law enforcement officers in Orange County do an outstanding job and should be commended for their tremendous efforts regarding homelessness. Ending homelessness is a complicated task that exceeds the job description of any single occupation. Is it possible that we have unfairly placed too much responsibility on the shoulders of our law enforcement officers? Orange County jurisdictions should establish more effective policies that do not respond to the social issues of mental health, substance abuse, and poverty by creating laws that target homeless persons and therefore enforcing those laws with police action. Alternatives to criminalization of persons experiencing homelessness rarely exist, but there is evidence that new alternatives are changing the way that Orange County jurisdictions address homelessness. Recently in Santa Ana, police kept their distance while trained homeless outreach workers were dispatched to clear a homeless encampment downtown. And in Huntington Beach, a new partnership was established with Be Well OC, helping that city to launch its HOPE team, which responds to non-criminal and non-violent mental health and substance abuse crises by dispatching civilian mobile crisis response teams consisting of emergency medical technicians and clinically trained counselors rather than police. And we're seeing this ability to duplicate these services in other jurisdictions. Housing is the key to ending homelessness and should always be the focus of solutions that end homelessness. Every shelter visit should result in transition into some type of permanent housing. In the absence of housing, shelters contribute to a never-ending cycle that actually perpetuates homelessness. Far too often, homeless persons in Orange County exit shelters and return to the streets because they lack opportunities for permanent housing. Currently, there are promising opportunities for increasing housing for homeless persons in Orange County, but we must remain vigilant in pursuit of opportunities and execute them to their maximum benefit. Project Homekey, a state project that provides funds to Orange County to secure and convert motels into permanent supportive housing units and services for homeless persons, successfully led to the purchase and current renovation of 2 motels in Stanton in its first round. These Stanton locations could potentially provide housing for more than 200 homeless persons, but still fall short of meeting the needs of the unsheltered population in Orange County. The overall success of Project Homekey relies on the county to capitalize on future rounds of state funding and the ability to create units of permanent supportive housing in all 3 Orange County service planning areas. Recently, more than 1,000 federally issued emergency housing vouchers were awarded to Orange County to provide emergency housing for homeless families and individuals. Early reports show the expedience of public housing authorities to assign vouchers to families and individuals, but challenges still lie ahead for them in finding available rental units and landlords that will accept the vouchers before the vouchers expire. As a recommendation, immediate evaluation of this process should be made and additional support applied where necessary to ensure that each voucher results with a permanent placement in housing. Additionally, supportive services that promote future housing stability should be further examined and goals should be set to ensure low rates of recidivism among voucher recipients. 2021 was exceptionally difficult for the impacted health of homeless persons in Orange County due to the ongoing COVID-19 pandemic. If lessons are learned, perhaps we will be better prepared in response to any future surges of COVID and also in the event of possible future pandemics. Finally, there are just too many of our homeless brothers and sisters and neighbors dying in Orange County without healthy, safe, and secure places to call home. 2020 established a record of 321 homeless deaths here in Orange County, and now 2021 is likely to surpass that total and set a new record with as many or even more than 350 homeless deaths. And I do not see this as acceptable in any manner, not in Orange County. I hope that you will join me in urgently recommending that county commission be established for the purpose of studying the homeless mortality crisis in Orange County. This proposed commission would collect data in partnership with the Orange County Coroner's Office and develop strategies that would provide policy recommendations, conduct public hearings, generate annual reports, and otherwise find ways to reduce such high numbers of homeless deaths in our county. Thank you very much for your careful consideration of these issues mentioned in this address. I entertain and await any response with gratitude and appreciation. Thank you.
Thank you so much, Tim. I'd now like to invite Doug Beck, the Acting Director of Care Coordination at the Orange County Healthcare Agency, to provide his remarks.
Good afternoon. I'm Doug Beck, the Acting Director of the Office of Care Coordination within the counties of Orange's healthcare agency. The Office of Care Coordination engages stakeholders across Orange County, working with cities and community-based organizations to strengthen regional capacity and multi-city, multi-sector investments into preventing and addressing homelessness. We are responsible for coordinating public and private resources to meet the needs of those experiencing homelessness in Orange County and to promote the integration of services throughout the community that improve our county-wide response to homelessness. Before I talk about the work our office as part of the county is leading to address homelessness, I'd like to provide some data based on the 2019 point in time count conducted. Through that count, we conducted in 2019, there's a little over 6,800 individuals experiencing homelessness, with just under 2,900 of them in shelter and 3,900 were unsheltered. Fortunately, as mentioned before, the COC, which the Office of Care Coordination serves as the administrative entity of, will be facilitating a new point-in-time count in just a few months in January of 2022. And this will provide us with critical updated data that will help form policy and programs moving forward. For the 2022 count, we are excited to partner with CityNet to facilitate the point-in-time count, and we'll be looking for volunteers and donations as we near the event during the new year. This event will be conducted from the 25th to the 27th of January. Now that I've provided some context to the current state of homelessness in Orange County, I'm going to highlight some key efforts taking place to help improve that landscape. On our most fundamental level, the Office of Care Coordination oversees 2 county shelters serving individuals experiencing homelessness and providing technical assistance to non-county shelters as well. The county recently adopted the Standards of Care, which documents guidelines that provide a foundation in the governance, delivery, quality, and performance of county services. The Office of Care Coordination is working with local shelters to provide that technical assistance to implement these standards of care to ensure consistent service delivery regardless of where an individual is accessing services. Another development has been the implementation of the county's Care Plus program. The Care Plus program is a multidisciplinary team approach to addressing homelessness. It's currently being facilitated by county department representation only. The Care Plus program is for those high utilizers of the county systems of services, including probation, behavioral health, social services, and other services designed to connect individuals with the right services at the right time, regardless of their point of entry. It's a holistic view of individuals with the goal of reducing utilization by ensuring their individual needs are met with the assistance of each county department participating with a no wrong door approach. Additionally, as the Executive Director of the Commission to End Homelessness, I'm interested in highlighting some of the progress and current work the Commission is embarking on. As Supervisor Chaffey mentioned, the Commission is exploring new ideas and innovative programs, making recommendations back to the Board of Supervisors on next steps to develop and enhance the homeless system of care. We're currently focusing on the prevention pillar and working diligently between meetings to come back to the Commission with tangible action items and next steps for each pillar, which these pillars include prevention, outreach and support services, shelter, and housing. This will help shape the overall regional policy dialogue for those wanting to be a part of the solution and really capitalizing on best practices, programmatic principles, and lessons learned. When the pandemic hit, the county quickly responded and started implementing programs to ensure those individuals and families experiencing homelessness were receiving care needed to mitigate the impact of COVID-19. As mentioned before, some of these programs include Emergency Rental Assistance Program, Project Room Key, and the Home Key Project. Project Room Key was established to provide isolation and quarantine locations for those who were sick or symptomatic of COVID-19, where they would be able to not only self-quarantine, but receive meals, get medical oversight, and support services that they highly need. It's a unique opportunity to engage, assess, and facilitate housing placements for many individuals experiencing homelessness who were not previously engaged with the homeless system of care. This program is was crucial in developing our project tool belt and engaging individuals to receive permanent placement either through Home Key or other housing resources. The Office of Care Coordination was also responsible for administering the Emergency Rental Assistance Program, specifically its first round, which provided assistance to those residents in Orange County with past due utility bills and/or rental arrears. This program was administered in partnership with 2110C, Pathways of Hope, Volunteers of America, Family Assistance Ministries, and United Way. The total ERA funding for that first round was just under $66 million. The second round of ERA funding has now been funneled up to the state to administer and process for those seeking rental assistance in Orange County. And Orange County was allotted over $82 million in that second round. To access the state ERA program, please visit housing.ca.gov, and there will be a link to apply along with a phone number for any questions. Currently, the county is working with local developers and cities to discuss opportunities for Project Home Key sites. As mentioned before, in the first round of Project Home Key, the county was able to secure 132 units in the city of Stanton. We believe there will be several other developments throughout the county that will receive that critical second round funding. This will be critical in our efforts to reach our goal of 2,700 new units of permanent supportive housing by 2025. Additionally, as previously mentioned by Supervisor Chaffey, vaccines are readily available to those seeking them against COVID-19, including those experiencing homelessness. County of Orange has also worked to make information available on the COVID-19 vaccines, including information on how and where to access the COVID-19 vaccine to those experiencing unsheltered homelessness and homeless service providers working with this population. We are encouraging all those in our shelter system to get vaccinated, and we have partnered with 2 federally qualified health centers, Share Ourselves in Costa Mesa and Families Together of Orange County and Tustin, to support the education and vaccination of individuals experiencing homelessness in our community, both for those in shelter and those currently unsheltered. The Orange County Healthcare Agency Outreach and Engagement Team and CHAD-H, Comprehensive Health Assessment Team, regularly conduct outreach on the street and help connect individuals experiencing homelessness to those health services. As we continue to look forward and towards the future, the goals for the Office of Care Coordination in partnership with the Commission to End Homelessness, the Continuum of Care Board, and the Board of Supervisors includes continuing to strengthen collaboration with cities and other interested stakeholders on addressing homelessness. This means fostering new relationships with both internal and external stakeholders who can provide services and resources in this space. Additionally, there is a need to develop a homeless action plan for the County of Orange, which identifies the next steps and a vision for the future to come. This will also help define the roles for all in our community who would like to participate in addressing homelessness and ensure we all work together, combining our efforts to reduce and prevent homelessness. Lastly, I just would like to thank United Way for the opportunity to speak today, and I look forward to working with you all in the next year to help continue to address homelessness in Orange County. Thank you.
Thank you so much, Doug, for those remarks as well. Before I bring us to a close, I just have a quick question that I would like to pose to each of you. So this was our very first State of Homelessness Address. We will run this event again next year during Hunger and Homelessness Awareness Week. And I would like to ask you, what is one thing based on your remarks today that you would like to see has happened in the next 12 months when it comes to addressing homelessness? And Tim Shaw, I'll come to you first.
Thanks, Becks. I'm going to cheat. I'm going to rip 3 things off real quick. Comprehensive fiscal mapping and a pipeline indicating that we'll reach 2,700 permanent supportive housing units. And also, I'd love to see all of the emergency housing vouchers leased up.
Wonderful. Thank you. Supervisor Chaffey, I'll come to you next.
Yes, thank you so much.
Supervisor, it seems like we're having some issues hearing you, so I am going to move us on.
Supportive services, which means constructing a lot more affordable housing, and that means fewer people on the street. We also need to provide like on-street medical services, both physical and healthcare. That's my answer.
Thank you, Supervisor. Your audio cut in and out a little there, but I think we caught
am I
most
not
of what you
connected?
had to
What's
say at the end. Tim Houchin, I'll come over to you.
Yes, first of
I
all,
think I'm frozen. I don't know.
most importantly, I would like to come back next year and see that the total number of homeless deaths had decreased. And secondly, I'd like to come back and see that we are engaging in a more collaborative effort between Orange County and its jurisdictions that crosses all layers of government from federal, state, and county and local jurisdictions, and includes the participation in the act of ending homelessness by all individuals of the greater community.
Thank you so much, Tim. Doug, I'll come back to you, Doug Beck.
Yeah, I completely agree with actually all three. And I'll add one very specific one in the spirit of being it slightly unique. I think what I'd like to see by next year is hopefully more resources in South County, an area where people who are experiencing homelessness, unfortunately don't have the same resources available to them in the central or north SPA. So.
Thank you so much. A huge thank you to each of our speakers for your informative remarks today and for the work that each of you do to move forward the collective efforts to end homelessness in our community. This event has been recorded. It will be up on our United to End Homelessness Facebook page, and it will go on to YouTube tomorrow in case you want to come back and do a quick refresher on some of the facts. I know it was a lot of information that was presented. Homelessness is an issue that affects all of us, and we all need to be involved in the solutions, which, as you heard today, means increasing permanent housing options available in our community and ensuring that we have appropriate holistic support services so that people are able to remain housed. Thank you to everybody that tuned in for today's event. As mentioned earlier, it is Hunger and Homelessness Awareness Week this week, and I would like to invite everybody to attend our next event on Thursday at 12 p.m. It's called Passing the Mic. Myself and Tim Houchin will be hosting that event, and you'll be able to hear directly from people who have experienced and survived homelessness here in our community. It is sure to be a powerful and meaningful conversation. You can find more information about Hunger and Homelessness Awareness Week on our website, unitedtoendhomelessness.org. Again, thank you, everyone. Thank you to the speakers, and thank you to all who attended.